Hello there. I'm Dr. Prashanth Kadia, the Medical Director of Interventional Endoscopy at Methodist Dallas Medical Center. I wanted to speak to you about a procedure called endoscopic sleeve gastroplasty. This is a novel endoscopic procedure that we use to treat obesity in patients and help them lose weight. You may know that almost 1 in 3 Americans now meets criteria for obesity, and that has led to a increase in a number of comorbidities and diseases related to obesity, including hypertension, diabetes, acid reflux, and a multitude of cancers as well, and heart disease, to name a few. So this is a true epidemic in our society, and treating this and getting this under control will help our population be healthier over time. The true method of treating obesity over time has been proven to be obesity surgery or bariatric surgery, where significant surgical interventions are made on the stomach or the intestinal tract to try to help patients lose weight by either restricting the amount of food that they can eat or reducing the amount of food that they absorb through their GI tract. But many patients don't qualify for these surgeries, and there are risks associated with these surgeries that often deter patients. So there's almost 80 to 100 million Americans that meet criteria for obesity that are either unwilling or don't qualify for bariatric surgery. So in the past, decade or so, endoscopic interventions done with a camera that goes down the mouth, and all of the work is done from inside the body, have been created to try to give new options to treat obesity in these patients. And one of them is called endoscopic sleeve gastroplasty. This is a procedure where we go down with a camera and endoscope while the patient is asleep. And we go down into the stomach, and we use a suturing technique inside the stomach to reduce the size of the stomach. So the stomach is usually a very large, floppy kind of organ, football-shaped kind of organ that if you go down and use some sutures to reduce the volume of it, we can actually make it kind of very slim and almost like a banana-shaped organ and reduce the volume of it by almost 60 to 70%. And when doing this, affects patients' hunger, their satiety, and their ability to eat, and actually results in large studies that have been published now in about 15 to 20% of their total body weight, which is a significant amount of weight, which allows them to improve their overall health outcomes and quality of life. Compared to surgery, endoscopic sleeve gastroplasty is a very nice option because it's an outpatient procedure. We do this in about an hour and a half. The patient comes to the hospital, gets the procedure done, and goes home the exact same day. They don't have to be admitted to the hospital. Their recovery time is very, very little, and they do very, very well after these procedures. It's been shown to be safer than a lot of bariatric interventions in terms of surgery, and also less acid reflux afterwards. The downside is that it may not result in as much weight loss as some of the aggressive surgical interventions like gastric bypass, but it does result in a significant amount of weight that is meaningful to patients, and it helps them with their quality of life, their health outcomes, and even obviously their cosmetics and such. So this is a very nice option for many patients. We've been performing it now for multiple years at Methodist Dallas with very good outcomes, and we're happy to discuss an opportunity to help you with your obesity if you have that inclination. So please reach out to us. We're happy to speak to you, and contact us if you're interested in this procedure, and we can chat with you some more. Have a good day.